Hi, everyone. It's Rachel here to discuss our discussion number one. Our discussion this week was about what a system analyst is and what a business analyst is in health IT. And a system analyst makes sure that the EHR systems are running smoothly, and they do so by making sure systems are up to date, making sure staff is educated on the system, and making sure that the system is secure. A business analyst makes any changes to an EHR system if needed. Sorry, I moved the slide. If any changes are needed, this person recognizes the need for change and any extra requirements that are needed. They also study how the change will be beneficial for the facility. So we had to choose three job listings for both the system analyst and the business analyst, and I got most of my job listings from Indeed.com. So the first organization is Rotham Orthopedic Specialty Hospital, and their job description was to provide daily support, education, security, and testing of EHR systems. Um, their qualification is an associate's degree in health informatics or similar and experience with Meditech. I was surprised to see that because most jobs require at least a bachelor's degree. They should have knowledge with Meditech elements and have 5 years working in the healthcare system and 3 years of clinical work and more. And their salary is about $50,000 a year. And you could find this job listing at the link below. The second organization is Archbold Medical Center, and their job description is to act as a teacher, form new reports, and present on new solutions for the systems. They require a bachelor's degree and experience in SQL. They should have experience with hospital finance and crystal reports, and they make about $60,000 a year. The third organization is Beacon Health System, and the person hired for this job should be able to plan projects, develop solutions again, and maintain existing computer software, whether that's by providing security and updates and things like that. They require technical skills, attention to detail, problem solving skills, organization skills, and more. And experience in computer science is beneficial, 2 years, and they could make upwards of 60 grand a year. And here is my three job listings that I found for business analysts. The first organization is BMR Infotech, and their job description is to help engage physicians to use EHR to promote patient engagement. And this could be hard sometimes because I know the physician where I work, he does not like to use the computer. He rather write orders on a paper chart, and he does not like to use the computer. So this could be a difficult task. They should have skills and knowledge using EHR systems, obviously, and have HIPAA knowledge, which is also important. They require a lot of experience, about 10 years working with an EHR system and 5 years working with the state Medicaid and more. And I couldn't find like an overall salary for this one, like a yearly salary, but they said that they would pay $45 to $55 an hour. The second organization is Vision Technologies, and their job description is to analyze, develop, and troubleshoot Epic systems. I know Epic system is a type of EHR, but I don't know too much about it. They require a bachelor's degree in business management, solve problems in analytical ways, and they should be able to understand healthcare hardware and more. 3 years in population health and 1 year as a business analyst is the experience requirement or would be beneficial, and they can make upwards of 65 grand a year. The third organization is Hennepin Health, and their job description is to conduct claims, reconcile claims, facilitate reimbursement, and more. And when I think about that job description, I think it mostly has to do with coding, like number coding and Medicare codes and things like that. Qualifications and skills, a bachelor's degree in business administration or similar, experience 3 years working with Medicaid or Medicare, and they also could make upwards of 65 grand a year. And I provided all the links on each slide in case anyone is interested. And these are my citations, and thank you so much for listening.